Not unlike other big cities in the US, Phoenix in Maricopa County is suffering from an opioid epidemic. In 2021, there were 2,500 opioid overdose fatalities in Phoenix alone. First responders and paramedics responded to 700 to 800 overdoses each month in 2021, and 21 million fentanyl pills were seized across the state. Due to Arizona's current mitigation practices, there were only 991 drug overdose fatalities in Phoenix in 2022. Although this is a huge improvement, there were still 46.7 per 100,000 non-fatal opioid overdoses and 22.3 per 100,000 fatal opioid overdoses in Phoenix. Something unique about the Phoenix area that intensifies overdose instances is the extreme heat of summer months. This especially affects unsheltered and unhoused populations. Opioids elevate the risk of fatal heat illnesses. Opioid substance abuse causes malnutrition and dehydration, which rapidly speeds up the course of heat illnesses like heat stroke. In 2020, opioid use contributed to 58% of all heat deaths in Arizona and 72% of all unsheltered population heat deaths. Arizona has taken a lot of proactive steps to mitigate the opioid crisis. It started with the Arizona One Agreement, where the state secured more than $50 billion across 10 separate settlements from rightfully holding the pharmaceutical industry accountable for their role in causing the opioid crisis for the state. In Arizona, 75% of heroin users in treatment started with legally prescribed painkillers. This settlement money is in the process of being distributed across counties and cities for prevention, treatment, support, and education of substance abuse disorders. The Arizona Opioid Epidemic Act, signed by Governor Ducey in 2017, helped form a groundbreaking plan by implementing evidence-based programs and strategies. Some of the most notable strategies was the implementation of the Good Samaritan Law, which encourages people to call 911 in the case of potential opioid overdose cases by prohibiting law enforcement to arrest or charge for any drug-related crimes occurring on the scene. This allows someone who is experiencing an overdose to access treatment quickly without legal repercussions. Another is the Angel Initiative, which allows citizens to walk into designated police precincts, turn in their substances, and request treatment without fear of prosecution. It also allows secure placement for their children without placing them into the foster care system. Some other strategies include training first responders and law enforcement to carry naloxone or Narcan, and also making naloxone more freely available to the general public without prescriptions. Cracking down on doc shopping, implementing a 5-day limit on first fills of opioids, closing the access to treatment gap, and holding manufacturers accountable for defrauding the public about their products. I myself obtained free naloxone a couple years ago from a local nonprofit after hearing an ad about it on Spotify. The public health campaign I heard encouraged the public to carry naloxone in case of emergencies, whether they use substances or not. Having Narcan more easily accessible and available throughout the public prevents a lot of overdose fatalities. Something you can do to reduce the stigma around opioid addiction and substance abuse disorders is to simply change your vocabulary around the subject. Words are really powerful, and easy vocab changes can help people reduce the shame of their usage. For example, instead of saying addict, abuser, or junkie, you can use person first language like person with substance use disorder or person who uses drugs. Instead of saying clean, you can say person in recovery. And instead of saying drug problem, you can say drug addiction, substance use, or substance use disorder. Thank you.